everybody, it's Dr. Brian here. We've had a few people ask about our decompression table, and this is our KDT decompression table. What decompression is, actually, there is traction and decompression. Traction is actually the literal meaning of decompression. Decompression is the desired effect of the traction. And between each bone we have disc, and patients that have disc-related problems, like a disc bulge, the effect of the traction and decompression creates a negative disc pressure, kind of like a vacuum effect, and as the table gently pulls and distracts, it allows that disc to be retracted or pulled back up in between the two bones, and the benefit of removing that pressure off of the nerve. I'm going to show you a couple examples of the way that patients can be set up on the table. The examination that we do is very important. That allows us to determine the position that the patient is put in, because we want to put patients into positions that do not provoke the pain. So Meredith, our nurse practitioner, is going to come over and we're going to show you an example of how a patient would look on the decompression table. So Meredith, come on over. If you would, just lay face down. Now as the patient lays on the table, what happens is we wrap this belt around the patient's lower back and waist, and then we attach the traction head with this cable to this belt, and then determining what amount of force or weight that we want the traction head to pull and the time, that is all determined through our evaluation. And basically we just hit the start button, and about 10 minutes later the therapy ends. Now we're also going to show you how we can do cervical traction for problems with the neck. So Meredith's going to raise up here and swing around and lay onto your back for me. Just lay your head there. So this is the general presentation for a neck-related problem. The patient is laying on their back. We attach the cervical device to the traction head. The cable is attached to a hook, and then when we hit start, there's a very slow pull onto the patient's neck. So if anybody has any questions about our decompression table, please give us a call, and we'd be happy to schedule an appointment for you to come in and talk with us.